Welcome back, everyone, and thank you for joining us for this special Earth Day episode on April 22nd. Today, we're going to take a slightly different approach. Earth Day is not only about protecting the environment around us, it's also about understanding how the environment affects the health inside of our bodies. From the air we breathe, to the water we drink, to the chemicals in our homes, in our food, environmental toxins have become one of the biggest hidden stressors affecting inflammation, hormones, cellular health, and the nervous system. Today, we'll be discussing how modern environmental toxins may be impacting your health every single day, often without even you realizing it.
Everybody, I'm Cameron. Today I'm here with Dr. Chris Cormier. Today is also Earth Day, so we're going to be talking about how the health in your body is affected by the earth. Hello, Dr. Cormier.
Hi, Cameron.
Earth Day began in about 1970 as a response of the growing concerns of pollution, contaminated water, pesticides, and toxic waste. Today we want to connect the health of the planet with the health of the human body. Dr. Chris, why is Earth Day not only about protecting the planet, but also about protecting our health?
So our bodies are single-handedly the most important asset we ever get, right? So when it comes to our bodies, it's really up to you to take care of your body more than anybody else. So when it just like we're trying to take care of the planet, so many people are in that mission of trying to take care of the planet. We want you to take care of your own body. This is your planet, right?
Yes.
Your own planet right here. And the better you're able to take care of your planet or your body, the better your body is. And there's so many factors that can disrupt the health or disrupt the cellular health within your body. Keep in mind, we have around 30 trillion cells each. So each person, some of those cells, the more of those cells that get unhealthy, the more problems you have. And remember, there's three different types of stress that can affect your cells. It could be a physical stress that you encounter, an emotional stress, or an environmental stress.
And you do talk about these different stressors at the Nerve Health Institute. Can you explain how the environmental toxins fit into that third stressor category and why they're such a major issue today?
So the environment right now, I tell people all the time, it's getting incrementally harder each minute, each second to live on planet Earth for so many different reasons. We're man-making so many different things, and basically the more man-made we get and the less God-made we get, the more problems. And so it would be wonderful to be able to go back and simplify things and keep things easier. But we've kind of gotten out of control in a lot of different capacities, whether it's chemicals and pollutants and toxins and additives and preservatives and, 5G Wi-Fi, right? The food's no longer God-made food. It's almost hard to distinguish, especially in the United States, what's God made versus man made, and so all of those things have side effects for us, and some people are able to handle some chemicals or toxins better than others, and some people are not, and it's relative to your body, to your nervous system, to all the genetics that have been passed to you, to everything that you've been throughout your entire life. But the environment is such a major part of your day-to-day overall health.
I think a common misconception is that people think that toxins only come from factories, but they are often found in a lot of household products, plastics, cleaning sprays, cosmetics, and a lot of processed food packaging as well. What are some of the most common environmental toxins people are exposed to every day without realizing it?
There's so much. I mean, you just think about the air. You don't know what you're breathing anymore, right? You don't know if somebody sprayed an odorless chemical or a pesticide.
Yes.
You're driving down the road and you don't know what's there. You don't know if somebody has any kind of pesticide that gets on your skin. Maybe you kneel down when you go to a hotel or the grocery store and you don't know if there's pesticide on the ground. I mean, there's just so many chemicals and toxins out there. But beyond that, it could be maybe some foods that you're eating, right? So you think, oh man, I ate whatever and it doesn't have any impact on me. I feel good. But there could be all kinds of chemicals in the foods or drinks that you're consuming. It could be chemicals on the clothing that you're wearing. I mean, there's so many different things, right? Even in the plastics, like you were mentioning, the microplastic part of it now is just there's so much. There's microplastics in the air we're breathing. There's microplastics in all the plastic products we're using. So much of it is around us. There's more in the environment exposure-wise for a human body, like I said, than ever in history.
Crazy. Water pollution and microplastics, like we were talking about, and a lot of chemical residues are increasingly being found in our water supplies worldwide. How important is clean water for cellular healing and detoxification perspective?
I always talk about our OWL method, and water is number 2 in terms of the number ingredient, or the second most important ingredient in the human body. So it's literally number 2. Number 1 is oxygen gas, which most people don't know of. But that's why you can't do it without breathing. Mm-hmm. Number 2 is water, and so we should be at least 60% water. And you want your water to be really, really clean and really structured and energized on the inside. You don't want it to be nasty looking water, right? Because you should be 60% water. The cleanliness of your water definitely dictates your health.
Research also shows a lot about these endocrine disrupting chemicals, such as BPA, phthalates, pesticides, that may interfere with hormones and metabolism. Can you explain what hormone disrupting toxins are and how they affect the body?
Yes, so many of these hormone disrupting chemicals, you have all these glands within your body, right, that it should produce hormones on demand, which is a crazy thought, right? So our bodies, we have so many hormones that get produced, and hormones are, I would say, out of all the ingredients that are in our bodies, the tiniest amount of hormone will change your body the most. And it could be a hormone your stomach produces, or your pancreas produces, or your hypothalamus. So many hormones get produced on demand. What happens to people is we can have all these things that we ingest that can actually shut off the production centers of these hormones because they confuse the system. They even mimic sometimes what a hormone looks like in the body when you're ingesting them, and the body gets confused and says, well, I don't have to produce this or this or this, and it causes all kinds of disruption within your endocrine system, which is your endocrine system is the system that produces all your hormones.
How can long-term toxin exposure affect nerve signaling, brain fog, sleep, and nervous system regulation?
Yeah, so many. The longer we're exposed to these endocrine disrupting chemicals, the longer we're exposed to these types of chemicals, it's like the body finally gets to a point where it has trouble getting rid of them. You want to think of the way the body's designed. It's designed to pull in good ingredients, and it's designed to spit out bad ingredients, right? So all of us are going to have bad things that get in our bodies. And what we want for people is to have more good than bad on a day-to-day basis. But the average person, what we see all the time, is more bad than good. And they're doing this for a number of years. And then by the time they come to see us, they're like, I don't know what I did. I don't know what I did. I mean, I've done everything. I thought I was doing good. And they don't realize that there's so many of these day-to-day factors that are adding up over time. And the body finally gets to a point where it just gets so toxic, it doesn't know what to do anymore.
People also spend most of their time indoors nowadays and often getting exposed to, like I said, the cleaning products, mold, dust, synthetic fragrances, and flame retardants. What changes can people make at home to reduce this possible toxic load?
So many changes to the indoor air. Probably over 10 years ago, I started to realize how bad indoor air is. You know, at the Nervehealth Institute here, we see people from all over coming from different states and countries, and we just see really sick people a lot of times coming to see us. And so I wanted to protect me and my staff and our patients from each other. And so I invented, it's all natural. It's just natural oils, essential oils that we had tested at a local university. Amazing results. I can't share with you the results because the FDA has policies that says if it's not if you put artificial ingredients, you can make it a drug, which I'll never do. But it's all natural ingredients, and those it's a product called Oil to Air. You can check it out. We have, but we basically have a diffuser that hooks on your return air, and it circulates through your whole house, so or your office, and it's able to help clean the air naturally. So I think what people need to understand is if you're indoors all day, you got to assume there's going to be toxins in that air, right? It's just impossible to maintain a fully clean air indoors with your house or your office. And so you got to have some strategies on a day-to-day basis that you're worried that you're focused on cleaning that air for you, to be able to help, because otherwise that's one particular category that could just be a puzzle piece that turns into this. It maybe starts as a small one and over time turns into a massive one in terms of your overall health or lack thereof.
Food packaging, plastics, pesticides, and ultra-processed foods all contribute to this environmental toxin exposure. How much does diet and food packaging influence toxic exposure and inflammation?
Again, it's just like a load, right?
Yeah.
It depends on your load. The amount of those things that you're getting into your system, if it's just so much over time, your body just gets to a point where it can't take out all that it should, and then it starts storing some of those bad things. It's actually been documented nowadays that there are microplastics like in organs like the heart, and basically the body doesn't have a choice. When these toxins, these microplastics, all these things are circulating throughout your body. You basically don't have anything else. They can't go anywhere else sometimes. So I'll tell you, we've been a non-invasive clinic at the Nerve Health Institute for decades. And I finally realized, look, people are so toxic, we got to do something. So basically I have this new therapy called EBOO, and it's called extracorporeal blood oxygenation, ozonation. It takes the blood out of one of your arms, filters that blood, 60% of all the toxins, microplastics, microbes, all the gunk that's been in your blood, for all these years, and then it actually reoxygenates and ozonates it and puts it back in the other arm. So it's very similar to having like a blood oil change. And so that has helped our patients tremendously, because when you're able to remove a significant portion of the toxic load from the body goes back into self-healing. So I firmly believe that's a procedure that people should be doing periodically to maintain that toxic load, or decrease that toxic load so that it's not overwhelmed.
Children may also be very vulnerable to these toxins because their bodies and nervous systems are really still developing. Why are children especially sensitive to environmental toxins?
Again, I'm 53 at the time of this recording. Mm-hmm. You can imagine when I was growing up, in the 70s and the 80s, we didn't have quite as much, not even close to as many environmental things that they have now. Now it's so much for a child being born, after 2020, all these years. I mean, there's so much, and when they're born into this world, I mean, they've got to adapt, right? That's the key with the human body, is being able to adapt. And unfortunately, like I said, it's been such a jump in the environmental toxins, pollutants, chemicals, additives, 5G, Wi-Fi. I mean, all these things have come about, in the last 30 years, and have really, really gotten out of control. So I feel like I wish we could just reverse some of the things. We have some good, right? Some good in there. Don't take my Wi-Fi away. I mean, I understand there's ways of protecting that people don't know about. We have all kinds of ways. So I would encourage people, like, for instance, so many people just don't know. They don't even know that this exists, right? All these things are affecting them. But that's why we have Nerve Health Institute, and for people that are unable to come here, we started Bodychargers, which is our online platform for teaching people all about this. In addition to teaching people, we're also providing resources and methods and techniques to do at home so that you can take care of yourself better. And then we change families, right? Mm-hmm. Because if you don't know and you're not aware and you don't make some changes to how you're treating your body, well, then you just teach your kids how to treat their body, and they teach their kid, and it just keeps this whole degradation in health. And that's what we've noticed over the years. So we wanted to make a dramatic change. That's our ways of helping people pay it forward.
Yes. So you do have that at-home help for our patients, but you also have your clinic, the Nerve Health Institute. If someone feels like their health has been affected by toxins, mold, inflammation, and environmental stress, how can the Nerve Health Institute help them identify and support their recovery?
Yeah, so basically here we're able to check all the major nerves in the body. So it's a method that we do manually that no other clinic well, I don't say no other clinic, but there's probably some other clinics across the globe that do it. But in terms of the entirety of what we have, I'm not aware of a clinic that has what we have for the body and for cellular health. The big distinguishing thing that we have, we try to teach or we try to make the brain aware, right? So if you come into my office and your body is holding on to a bunch of bad things, because it lost the ability to get rid of those things. We have to go back and update the brain and teach the brain how to get rid of those things, because otherwise it'll just keep holding on to them. And that's why we have thousands of frequencies of vials of different things here, everything from chemicals and pollutants and toxins and additives and elements. I mean, you name it, we have it here because we're constantly trying to make the body understand what it should be pulling in and what it should be spitting out. And unfortunately, this overwhelming load of things has forced the body or made the body weak a lot of times to these things. And so it's complicated, but it's not complicated. You want your brain to be able to understand what to pull in and what to spit out.
If someone is listening today feels very overwhelmed by their symptoms and worried that they may have been affected by all the environmental toxins, what message of hope would you give to them?
So definitely awareness, right? So I would say, this is a very clouded world. So like most people, if you're staying in the herd of sheep where you're just following along conventional and you have a lot of these issues, and you're not going to get a lot of answers, number one. And then you're going to want to come out of that herd. And when you come out of that herd, you're going to see fog because you're going to have influencers, you're going to have other doctors, you're going to have people online, some Joe Blow online telling you everything about what and you're not going to know what to do, right? You're going to be confused over what to do. So I would encourage people, we have no other purpose than to help people. And I've been doing this for decades, and everything we've done, we have been constantly learning and learning and learning. And honestly, we don't heal anything here. Your body does. We're focused on maximizing your God-given self-healing. So if you had to focus on one thing and you had to be appreciative of one thing and you had to have hope for one thing, know that God gave you this amazing body, and he gave you this body that can heal itself of just about anything. But you have to use the right resources. And so that's why we put together the things that we have, not only at the Nerve Health Institute, but also at Bodychargers, because we want people to come into a safe environment where everything's been tested and proven. And it's been years and years of my experience to be able to put all that in there to be able to help people. Not only the people out there I want to be able to help, but it's been the trials and tribulations of learning what to use and how to use it for me and my family and my patients and staff, for many, many years now.
Well, thank you very much, Dr. Cormier, and happy Earth Day, everyone.
If this podcast spoke to you, or if you feel like you have family members or friends that have these types of conditions that could benefit from this particular technology, then all you need to do is become a Bodychargers member or tell them about Bodychargers. Remember, it's our community that I created to help people at home with the best technologies in the world to be able to help you to self-heal your body at home and maximize your self-healing. So go to Bodychargers, become a member. That's the easiest way to get this done. And we look forward to serving you and your family. Also, if you want a higher level of care, we have the Nerve Health Institute you can always come to. That's our clinic where we have higher level services here to be able to help you. So I hope you enjoy, and we look forward to serving you and your family, and look forward to our next podcast.